Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxie, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ.
Welcome back to the show, COIQ listeners, for another episode of our COVID Pivot series. Today, I am speaking with Hila Goldman-Aslan with DIA Imaging Analysis. Welcome to the show, Hila.
Hi, thank you. Thank you for having me.
So let's start off by telling our listeners a little bit about your background and what you're doing these days.
Okay, so I'm, as you mentioned, the CEO and co-founder of DIA Imaging Analysis, and what we are doing is AI for ultrasound images. And I started the company with my partner, Michal. She's the CTO of the company. We actually are 3 women founders out of 4 founders in the company. And the 2 of us are leading the company, full-time in the company. And we started this company as an incubator company here in Israel. And the headquarters is here. And we have also a subsidiary in the United States. And they're very busy these days. Happy to tell you all about it.
So what were you doing from a business standpoint? You know, what problem and need you were meeting prior to COVID, and then let's talk about how you might have pivoted that some, now under the new crisis that we're facing.
So when you're talking about ultrasound, immediately you are thinking about babies. And actually today you are using ultrasound also almost to any anatomic area in the body. And ultrasound is a very safe imaging device compared to CT or X-ray that has radiation, or MRI, which is very expensive. So the use of ultrasound during the last decade or even the last 5 years increased dramatically. And what you're seeing today is those new handheld portable ultrasound devices that are being used all over in new areas that were never being used before, like emergency room, ICU, internal medicine. Paramedics use ultrasound today. And what we saw is a big gap between the accessibility of those ultrasound devices that becoming more and more accessible, but still the analysis of those images is being done by visual estimation. And not only in these new areas of ultrasound, what we call point of care ultrasound segment, but also in the dedicated ultrasound units like the radiology and cardiology. Still the variability between physicians is very, very high because they're mainly just looking at the picture and trying to analyze the images. And we decided that we want to address this issue and eliminate or reduce the variability between physicians by providing those kind of AI solution that will help them analyze those images in a very objective, quick, and accurate way.
Mm-hmm. Incredible. And so so let's talk about what stage of the innovation process you were in or you are in.
Yeah. So we started with cardiac ultrasound because, heart disease are the #1 cause of death in the world. And actually, when we are talking with even the emergency rooms in the big hospitals, they're saying that about 30% of the people entering the emergency room are complaining of symptoms that can be related to heart issue. And we figure out that it's very difficult to analyze the heart with ultrasound, even in the dedicated ultrasound or cardiac unit, because the heart is a moving organ. Still, the image of ultrasound is very noisy compared to MRI and CT. Also, when you take the image compared to MR or CT X-ray, when you're posing the patient and the device, with the ultrasound, you actually put the transducer on the patient, body and trying to find the right image, which is also very subjective and depends on the user experience. So for us, heart was the first segment that we looked at, and we developed a set of solutions to help them find all kinds of clinical indication that they are looking for by visual estimation and find it automatically and very in an objective way. And those kind of solutions, what we call the El Vivo Toolbox, already have FDA approval and CE mark. So we started to sell them to the market last year. And the way that we are doing it is that we partner with channel partners like ultrasound companies and healthcare IT companies that add these solutions to the ultrasound devices and the healthcare IT system. So any physician can actually use it when they are doing the process of taking those images. So we have partnered with companies like GE and IBM and Konica Minolta, and we actually seeing those AI solution being used even today with the COVID being the front line.
So that's really impressive. Those are definitely some big brands, right? Some really well-known brands around the world, not just, you know, in Israel or in the United States. And so let's just kind of talk about for our listeners a little bit of how did that come to be? How, I'm sure all of our listeners want to know, how did you land someone like IBM and GE to be your partner?
So it's a very long process. You have to build this relationship. Like everybody knows, it's not easy to work with any of these corporate companies. And I think that when we started, we right at the beginning, I think, even before we had a finalized product, even when we waited for the FDA approval and to have this process, we already started to talk with those channel partners. And that also helped us to understand the market and the needs and what they're seeing as an advantage, and when and how they are going to use that kind of solutions. So I think that the main thing that I learned is to talk with those channel partners as early as you can. Mm-hmm. And it also helps you with the product and to design it correctly, to understand not only from physicians, but also from the industry, what they are seeing, what they are hearing. And then you build this relationship because you are getting back to them every few weeks and tell them your progress and what you're doing, and meeting them at conferences. Today, of course, is really, really difficult to do that, but right. Back then we did that. And all the time meeting more people in the corporate and in this specific unit that you're working with. And once we had that kind of solution ready to implement, I think everything was also from their side ready for them to accept it. And another thing that I think that happened is the change in the market. So when we started, AI was like a big word that nobody knew what you are going to do with it. And also those big corporate thought that maybe we can develop it by ourselves, maybe we don't need somebody, maybe the market are not ready to accept or to pay more for AI solution. And definitely we are seeing in the last 2 or 3 years a big change in both segments. We see also the end user, which are the hospitals and clinics and physicians, even asking when they are buying new system on their existing system, asking their providers, what do you have now with AI? And I think it's really relating also to change in generation. Mm-hmm. And those new physicians, new doctors are used to work with technology, are looking for technology, want to use the advanced technology that is out there. Also, I see it from the vendors' side. They are actually definitely saying that they want to partner with third party because they understand they cannot develop everything by themselves.
Yeah. So let's go back to what you were saying of, starting those conversations with channel partners and, people that are part of the ecosystem really early, because I think that's very interesting. A lot of health innovators tend to think that they need to have something, polished and perfect before they get in front of anyone, especially some of these bigger entities, that they have a tendency to believe are going to have really high expectations for a startup. So let's kind of just talk a little bit about that. What were some of the considerations and how did that evolve?
So I think as a startup, there is a big difference, and I'm sure we will talk a little bit more about it later, about how well you are prepared for investors, for example. compared to your channel partners or customers. I think that there is more acceptance and we saw that with our channel partners, that we started the conversation very early, because they also want to be aligned with what's going on and what startups are doing, and they're looking for this kind of relationships and connection. So it's not for them, okay, and if you're too early, they will say to you, listen, you're too early. We will not do anything before you have, I don't know, clinical validation, FDA approval, or whatever. Yeah. So you will get a lot of feedback also of what they're thinking is more or less important. So I think with channel partners and customers, I think probably I would not go to all of them at once. It is very time consuming. I will pick those who are probably the leading one and the ones that you are really targeting. And with investors, I think it's different thing. With investors, you have to come prepared. I don't believe in just doing introduction just to get to know you. You have the time with investors. Usually they will ask you very specific question. And if you don't have the answer at that point, you are losing opportunities. So it's better, to reach out to investors when you're ready. Even if you are in early stage, A round, B round, be ready for those questions and with all the materials. Otherwise, I think you are missing the opportunity.
Yeah, so we'll talk about that a little bit too. So I think that what you just said is just really important for our listeners to kind of grab a hold of is that, and this is something that I advocate for quite a bit, is this idea of co-creating our solutions with our customers, with our vendor partners, and bringing them along in that process early on. There's two things that I've seen happen as a result of that I'd love to hear your thoughts on. Is one is that, a lot of times it saves the innovator millions of dollars on features and functionality that they thought were going to be so important, but through that dialogue and that co-creation process, they realized that it might have been really important to them, but it wasn't so important to their target audience or to those partners. And so they can save that time and save those millions of dollars, not wasting on that, to maybe have that for their go-to-market strategy. And then, of course, if you're building a solution with folks that are part of your customer segments, is that your ROI is going to tend to be higher, right? Because you know that you're building something that they want because they told you what they want and they were part of that process.
Yeah, definitely. And we actually had this experience several years ago when we started to develop something, and once we talked a lot with the industry, we realized, no, it's really a niche, and it's better not to put an effort. We put this development on hold, and we say to ourselves, if somebody will want that, so we have something like a prototype or whatever, but we are not going to continue developing it anymore.
Yeah. So let's also talk about access to those folks, right? So how in the world did you even have the chance to get in front of, the right people at those companies?
So I heard recently, I don't remember who it was that talked about marketing and about a business model. And he said something like, I envy the ones that have B2B relationship, because you know who you are looking for. You are looking either for the product manager or the business development, or you know the title and you know who you are looking for, versus when you're selling to consumers, which is much more difficult to get to the end user at that point. So I think that with time we understood who are usually the decision makers and who are involved in the process of deciding what to add and who to partner with and what they are looking for. And in our case, it was clinical specialists and product managers and business development guys, even sales. And sometimes it even came from the R&D teams that had a need, and they understood that it's not part of the roadmap, and probably it will give them a very big differentiation and advantage. And I cannot tell you that in each partner segment it was the same people,
right?
But I think that the best way to target them, of course, is going to those trade shows and even presenting yourself at the booth and saying, I'm looking for people that are doing that, this and that, And very quickly, everybody is connected to everybody else. And then somebody there will tell you, okay, I think you should talk to this person. And if this person thinks that he's not the right person, he will refer you to somebody else. So eventually you get to the right people. I think it's much easier than you think.
Mm-hmm. It sounds like persistence is key.
Yeah. Yeah.
Never giving up.
Hey, it's Dr. Roxie here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
So you were talking about the changing in market conditions, and I want to spend a little time on that, because bringing a disruptive innovation to market or something that's radical is very different than bringing it something that is just an incremental innovation. Both are incredibly valuable and both have their own place, but it's a different strategy, a different path that you'll need to take. And so it sounds like when you first entered the market that it was really radical and disruptive. And so let's talk about some of the challenges that you faced before those market conditions changed, and then how that really opened the door or the floodgates for you.
So I think that the beginning, and I think a lot of the startup companies at the early stage have a very big idea, and usually a lot of people tell them, you're crazy, you shouldn't do that, and it wouldn't work, and so forth. And so I think that mainly it's we had a very passionate idea that it doesn't make sense that in ultrasound you're still looking at the picture and saying, I think that I'm seeing this and that. And every time somebody tell, yeah, but we know, I know. And back then it was like the most expert ones to say, yeah, but I used to it. And we also always tell them, but it took you years to understand what to look for. Mm-hmm. And now with technology, we can make it more accessible and more smarter to those novice ones and the ones that are. And back then, it wasn't the ultrasound wasn't in point of care. So with the market evolving, and with AI getting like more acknowledgement and the awareness, I think that came together and gave us the big push, mm-hmm. eventually to be able to implement it. And actually have the first one and the first 2 ones are the toughest, but then you see the results. And now definitely we see that, as I mentioned, we are working with GE on their handheld ultrasound device. Today with the COVID, we see physicians use our AI in the front line. And I think I mentioned it before, but I'm always saying that the first time that we actually in the company were very excited and very proud and actually had tears in our eyes is that we saw a physician at South Africa using our AI, tweeting about that, saying how it helped her. Mm-hmm. And for us it was like that's it. That's the top for us, and that's right. Just so exciting to see that eventually physicians are using it, getting value out of it, helping them in the decision making. And that was for us to say, okay, it was all worth to wait for that. And I always say that the same in life, you cannot say that you are happy all the time. You have happy moments. And in the startup, it's the same way. You have happy moments, happy point in the startup that you say, okay, this is why I'm here. This is why we are doing that.
Yes, absolutely. So let's talk about that, right? Keep down this path of changing market conditions, right? Because you said, you first started and people were like, what is this AI thing? And how would that possibly prove valuable? And then the market kind of caught up. And so that was kind of a pivot opportunity for you. And then we're thrust into all things COVID really over the last couple of months, which is another opportunity for pivoting. So let's talk about, what was that like for you when this first started to happen? What were like the early stages of that process of thinking, I need a pivot? And then let's talk about what are some of the pivots that you've done. And, when I use the word pivot, it could be where I changed a business model, right? Something really major, or it could be just pivoting around messaging. And that's a lot more surface, reframing how my solution might meet a different need. So talk about that a little bit for our listeners.
So we didn't pivot anything about our business model, but we did do some upgrade or updates to our messaging. We did see very quickly through our channel partners that they are selling even more to the end users, to those in the front line in point of care ultrasound, their system with our solution. So very quickly we understood that we are part of this pandemic. We are giving value to those frontliners, and we are part, and we need to make everybody know that there is an advantage of using AI in the front line now. So very quickly we designed a web page all around COVID, and you can see it in our website. Yeah. And we prepared for all of our channel partners a one-pager, collecting all the information that we got during the last few weeks about the importance and the use of our AI, because those channel partners that are in front of the end users, which are the hospitals and clinics, we wanted them to have those messages in front of them to help those frontliners understand how they can use our solution and how it can help them today with the COVID. For example, we talked about that we have those solutions for heart, for the cardiac solutions. And we saw a lot of information and studies, even from China and Italy, showing that about 30 or 40% of the people that eventually died from COVID died from issue relating to heart issues. And everybody thinks lungs, but it's not only lungs. The lungs actually affect the heart, and then you're getting all kinds of issues around the heart. And the ability to use our AI solutions for the triage and for monitoring those patients, they receive the treatment, getting them better or worse, when you cannot bring CT, MR to these areas. And ultrasound is very small, it's very easy to clean. And it's very accessible in terms of looking at the body, inside the body, and see what's going on there. So having those AI solutions, and those physicians at the front line are not radiologists. They are not expert in taking images, and be able to help them and say, okay, put the transducer, look at the heart, press one click, see what the AI telling you, and then you can monitor the patient. We even talked to one of the biggest hospitals in New York, and they say we are opening now a tent outside and using ultrasound to screen who gets to get in the hospital, who stayed out.
Wow.
And for that, to have those kind of AI solution, that's mainly what we're doing now is addressing these messages and giving them a lot of information through our channel partners, at our website, at our social media, trying to educate the market about the use of our AI in this stage and in this pandemic. So I think that also another thing that I see in terms of market or marketing is that the awareness of those AI solution in imaging, even after this outbreak, will be in a different level. Yeah. Before we knew that this point of care ultrasound and AI is emerging and people understand more and more. Now we are in a different times. Now there is a peak. Now everybody's stressful and want to get educated. The awareness will be in a different level after this outbreak. So we expect to get even more interest after that.
So how humbling to know that something that you and your team innovated is really valuable on the front lines of this global pandemic. Like, who would have ever imagined 3-4 years ago that you would be able to have this kind of impact on people's lives? And isn't that why we're all doing what we're doing anyway, right? Is to really be able to help people in a way that the healthcare system hasn't helped them previously.
I think this is the advantage of working at a startup company in the healthcare area. I think also when we interview employees to the company and candidates, the main thing that we're hearing all the time is that, I used to work in a gaming company. I used to work in, and for me, the meaning of understanding that what I'm developing eventually go to the physician's hands, eventually affecting the patient is, what help you woke up in the morning and say, I have a great job. Yeah. Because I actually make a difference.
Yeah, absolutely. It's certainly unfortunate that it's taken a global pandemic to elevate the different use cases and value of digital health and technology and AI and, all of the different solutions that we have that have been available for a long time. But, for a variety of reasons, we haven't seen the type of adoption that we like, or that, for folks like you and I could be really valuable. And so I think that, it's interesting to see these use cases of how, technology in your solution with AI can really do things that humans don't need to do to free them up to do the things that only humans can do, right?
Yeah, we also always say that we are not going to replace those physicians. We're actually giving them another instrument in their toolbox. If they had blood tests and they have ECG and they have now they have AI that they can use to make better decisions, to give them confidence about the decisions. And I don't see that we are replacing them. As you mentioned, there are human interactions that you can replace. And I don't think that you will be able to replace it, at least not in the near future.
Right.
And yeah, I also think that in terms of investors and VCs, what we will see after this outbreak is more interest to invest in digital health companies. And we will see more VCs that have never thought of investing in healthcare now saying, oh, really, now I understand the value and I want to be part of this game.
Yeah, I couldn't agree with you more. So the other thing that I wanted, just kind of touch on is, the one of the big value propositions of AI in any application is really scalability, right? Efficiency, and be able to do something fast. And wow, what, those three attributes aren't needed anymore than they are now, right? Like we need to be able to act fast. We need to be able to scale, and we need to be efficient in order to continue to meet the needs and the burden that's being put on healthcare systems. So what an incredible opportunity we have to leverage technology like yours and meeting a need.
Yeah, definitely. I think that the AI is just at the tip of the ice now. And I think the next decade, we will see so many implementation of addressing what you just mentioned about efficiency and accuracy and making those physicians, be more efficient in terms of making decisions and the time that they are spending. Because right now they are either spend it by trying to mark things and look for things, or calling an expert and then waiting for the expert, or sending the patient to another exam. When everything will be with the AI solution, I think the health system, of course, will be more efficient, and definitely efficiency reflects the patient management.
Yeah. And I think, time will tell, but I don't know that we will ever go back to the current state of healthcare innovation before this pandemic. Will we be as far as we are now? Who knows? We'll see. But I definitely think that, the silver lining in this is that it is certainly a springboard for greater awareness, like you mentioned, and greater adoption.
Yeah, the awareness is going to, now all of us are very stressful, and everybody trying to understand where we are going and when we're going to get back to normal. First, I'm not sure we will ever get really back to what we were before. I think that we understood that already. But in terms of awareness, definitely it's a different story than it was before.
Sure. So let's talk about the Israeli ecosystem and support for healthcare innovation. This is something that you and I talked about previously, and I think it's definitely worth mentioning here for our listeners. We talked about this 95% of innovations that go to market fail to reach any adequate level of customer acceptance or financial ROI. And, you had some really great feedback in response to that conversation about what's different of where you're living and where you're innovating. So give us some insight on what's going on there.
So yeah, Israel is being concerned, and as you know, is the startup nation. And today, I think in every given time, you have 6,000 startups. And the population is 8.5 million people, which is the ratio is like, I think it's even very similar to the Silicon Valley, I think. Maybe the second one in the world. Part of it is also government support. The government in Israel is very, very pushing startups to emerge, putting a lot of investments in things that they know that in 99% of the cases will not emerge, and putting a substantial amount of money, like $500,000, even $100 million for you to start, even $50,000 for you to start and doing something. There's so many programs and so many applications that can be you can apply for, where the government is pushing you to actually try. And it's fine if you fail, because they know that the statistic is that you're going to fail and you can apply again for different things that you are doing. Also, when you are part of the university, and also the university urge you to try and apply for those grants in order to try to get out of what you developed with something. So DIA is a very similar example. My partner, Michal, she studied her second degree in one of the biggest universities here in Israel. And she had a great idea with this AI for ultrasound. I met her back then. And we said, okay, well, how can we start? And we said, okay, let's apply for government funding. And we applied for the incubator program here in Israel, that it's a 2 to 3 years program. That give you money and an expert and more of an accelerator environment for you to try it on and see how you work with that. And this is what gave us actually the push and the first opportunity to try to do something with this, invention. And it came out of the, second degree, a master degree of my partner. And now look where we are. So yeah, it's the environment here, the ecosystem here, a lot of support from also the government, also the big companies here that having R&D centers and inviting startups to meetups and to all kinds of events. And helping each other. I think that's also part of it.
Yeah, that's incredible. It's really wonderful to see, and you're right. There's certainly a lot of healthcare innovation that is just flourishing over there. So as we wrap up, a lot of our listeners are healthcare innovators that are in the trenches day in and day out, like you, and experiencing this COVID crisis. What advice or other lessons learned do you want to share with them before we end?
So I think the first thing, and we talked about it a little bit, is about messaging. Be very sensitive about what you are posting. And, nobody now wants to read about things that are not really aligned with what all of us are going through. You have to understand, I know that a lot of the people right now, in terms of statistic, don't have maybe even friends or family that are sick from this virus, but there's a lot of sick people and a lot of family that are affected from that.
Yeah.
So I think being sensitive about what you're writing, more educating the audience than trying to really aggressively sell. I think that's the first thing that I would say that is very important. Think of what in your product and your offering can help the end user right now. And if there isn't, so mainly invest more on your B2B relationship and then to just go out and try selling something that right now people maybe not really interesting to look at.
Yeah.
And that's one. And on the other hand, if there's an opportunity to change the business model and think of a different, of pivoting it to a different direction, I think it should be considered.
Mm-hmm. Great. Well,
Another small thing, I think also in terms of your employees, I think being very transparent and what is going on and why, if you're doing changes, being very transparent with your employees is very important. Everybody wants to be together, and everybody is having their own difficulties. We talked about a little bit that there are some employees with very small children at home, trying to be flexible there and give them the space of working early or late or whatever is needed, because we are all of that together and we have to keep staying strong together.
Yeah, I think that leadership is more important than ever in really being able to be a great leader during this time and being human and understanding, because we're all people at the end of the day.
Definitely, yeah.
Yeah. Well, thank you, Hila, so much for sharing your wisdom with our listeners today. How do folks get a hold of you if they want to follow up with you?
Through our website. Also, I will leave you my email. So if anybody wants to, they can reach me directly. I will be happy to talk to anybody that needs any help or want to learn more.
You want to give your email address here?
Excuse me?
Do you want to give your email address here, or do you want to just...
Hila, Hila, at dia-analysis.com.
Excellent. Thank you so much.
Great. Thank you. Have a great weekend and happy holidays.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app, like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.